Hi, I'm Dr. Erica Woekel. I'm a clinical assistant professor in the College of Public Health, and I am the program director of Lifetime Fitness for Health, which is the baccalaureate core fitness course that all students at Oregon State have to take to graduate. Are energy drinks actually beneficial? Are they as bad as some health experts say, and what are some healthier alternatives? Energy drinks come in different forms, and they can actually either be categorized as a food supplement or as a beverage, and so they have different requirements depending on how they're categorized. The thing to look for in an energy drink is the amount of caffeine in it and taurine, which are both stimulants. Caffeine is going to be that stimulant, we know what caffeine does to us, but taurine does the same thing, and those together will actually increase your thought that you have energy, but you actually are getting just more of the stimulant. They really are equivalent to a cup of coffee, but it does depend on the serving size. So if you have a serving size of an energy drink that's a big can, that actually could be 2.5 serving sizes, so that's something to be mindful of when looking at the label of caffeine and taurine. I always kind of go back to this idea of moderation and why do you grab an energy drink versus something else. So the question is, are they bad for you? Anything can be bad for you if you eat or drink more of it. So it would just all be about that moderation. Alternative to an energy drink would be if you're feeling like, hey, I need energy, it's 2 o'clock, I'm kind of hitting the wall, I need some energy. The actual alternative would be having some water, piece of fruit, and actually going for a walk. What are some tips and tricks for students to stay active and eat healthy? Well, that's a huge question, and we actually will talk all about that in your HHS 231 class, which you have to take if you're a student here at Oregon State. But when we look at tips and tricks for activity, do something that you enjoy, do something that there's a goal towards it that has a certain intensity, but it's something that you're going to do consistently. And when we talk about activity, it doesn't matter if it's line dancing or bowling or walking, it doesn't matter. But if you can do it consistently, that's going to bode well for the lifespan. With regards to healthy eating, I always talk about trying to plan ahead. So whether it's making a dinner plan or a meal menu, something like that can be really helpful. Even if it's only twice a week or 3 times a week, you have a dinner plan, wonderful. How long should I work out for on average? Do 7-minute workouts actually work, or do you need to go for like 2 hours? Well, that's a huge range of 7-minute workout to 2 hours. And ultimately, we would want to try to work out 150 minutes is kind of the minimum for adults to 300 minutes of cardio workout at a moderate intensity. So this is where it gets a little confusing. So moderate intensity is where I'm breathing hard, but I can still have a conversation with an individual. And so if I can do 150 minutes of that throughout my week, then I'm doing pretty good. In addition to that, I would also want to do 2 days of kind of strength training workout and some flexibility also. So a lot of times you can do that in 3 sessions a week. So if I'm doing some cardio and some strength training and flexibility, and that might be in a combination of like a group fitness class, then really I'm only going 3 times a week, and I can get those 150 minutes in that 3 times a week. So if you're interested more in health, we'll talk a little bit about nutrition, physical activity, and mental health within our class of HHS 231. But there's also lots of resources on campus to advocate for your health, whether it's Student Health Services, Dixon, physical activity courses, or CAPS, and so feel free to reach out to any of those resources or come say hi, and we can chat more about it.